7, 6, 5, 4, 3, 2, 1.
You'll never have the sacred stone.
Oh, this you crazy mother.
Hi Todd, I'm wishing you well. And I found this guy Paul. This guy was stalking me. He would not let me leave until I say get well to you. We're praying for you and we love you, Todd. Hang in there, buddy.
So
we have the model, but it's out at St. Mary's.
okay,
Last night it was being printed up. It takes them about a day to print it. So they we might be able to show it to you tomorrow morning. If you
Okay.
really need to see it. If not, we'll definitely show it to you afterwards
okay,
and give you an idea of what we did.
Okay.
But they just finished it up. It was not they printed it overnight. Things automated.
yeah. I was just kind of I wanted to get an idea for the whole
Yeah.
deal. Also, wasn't like first thing before they put me out. So, but
Yeah, I mean it's we're going to use it.
yeah,
I met with Rose last night. We discussed the surgery. We discussed the plan.
okay,
We're going to come down on the right side. It's pretty clear where we have to make the cuts on the right side. On the left side, we're going to try and come around the tumor. That's kind of where it's going to be a little bit more difficult. We may have to enter the tumor on that side
yeah,
to get it out completely. But I think we're going to get it out completely. And then Dr. Peterson.
You've actually seen this 3D model, though.
Mm-mm.
Okay, all right,
Well, I can visualize it without
Yeah.
it. It's helpful
Yeah.
to have it, but I
Yeah.
can visualize it without it.
okay,
But we'll have it tomorrow during surgery, which is when we wanted it
Yeah.
anyway. So we'll have it tomorrow before, and we can, and then once it's all out, Dr. Nelson, I think, or Peterson,
Peterson.
can come in and put the
plat.
plat on it. Okay, and then we're going to put in screws and rods to put everything back together that we took apart.
okay,
Okay.
okay,
And that's and what that's going to look like, and I don't have the whole model, but screws go in over here. They're titanium. Probably going to have to jump past the one level here because it's going to be missing. I know for sure right about here. And then we're going to go down here, and then we'll hook it into the upper chest.
okay.
And then we're going to use some banked bone, or some bone from our bone bank to do the fusion on that.
Okay.
Okay.
Yeah. I guess one of my concerns is I was talking to Peterson. She made it sound like they were going to remove some nerve roots on the right hand side, and I made like, okay, I don't want to lose any function of my right arm.
We're not going to do that.
Okay. So if there is
We're
like,
not going to do that because I'll tell you why. If we thought that was going to increase the cure rate of this, we'd do it.
Yeah.
It's not going to.
so if the tumor is touching those roots, then would the proton treatment, the next 11, help like try and kill that off? Is that the
It's all
thinking?
part of the thing. The plat is going to help kill it off too.
Okay.
Okay.
All right. So.
Okay.
All right. Because she was just like specifically said they're removing like the nerve roots on the right side. I'm like, what?
No,
So,
no, we're not going to do that. Now, we
Alright.
can injure those.
Yeah.
There's no doubt we can injure them by taking tumor off of them, but that's not the intention, is
Yeah.
to go in and cut them.
Yeah. Okay. Good. Okay.
Okay.
All right. So.
So those screws and rods gotta stay in them then?
Yeah.
Forever?
Forever.
Oh, fused neck. Yeah. Yeah.
Yep. And the other thing we talked about, and this is kind of a rare thing, is and we've seen it in a few of these cases where we've had to take out some of the muscles in the back like this, is doing the screws and rods in back long term may not be enough.
Okay.
Okay. And what we do sometimes, if that's the case, and we do x-rays, if we start to see things start to tilt, and we go in front. We put a couple bone grafts in here to kind of to give extra support.
Secondary surgery.
Yeah, I mean, I'd say 1 out of 10 times we have
Yeah.
to do something like that, but we'll know.
Okay. All right. What time are you thinking tomorrow morning? Is it-
It's first thing. Diane's
Yeah.
going to come in and give you all the paperwork
Okay.
to get out there and everything.
Okay. I was also curious, like, I'm taking some pain pills at night.
Yeah.
Like gabapentin. Is it okay if I take that tonight?
Diane's going to give you all the instructions about meds and stuff to do tonight.
Okay. So like gabapentin and
Mhm.
oxy I can take tonight.
Mhm.
Okay. All right. All right. The other thing was, what should I expect when I wake up?
It's going to hurt.
I mean, is it possibly like I won't have any movement in my arms?
No, your arm. I mean, if everything goes well, I mean, people are going to be yelling at you to move your arms and legs.
Yeah.
That's the first thing to expect.
Yeah.
But the arm, we're not. I'm not anticipating that we're gonna. I think your arm's going to be better when you get up.
Okay.
Okay, if everything goes well. Now, sometimes with manipulation, the arm is a little weaker, or hurts a little bit more, and then a day or two later, that'll get better.
Okay.
But I expect it to almost. And if things go well. And I don't want you to read too much into it if you don't have that kind of result.
Yeah.
But I don't expect the arm to be worse. Now, it can happen that's the case, but
Yeah.
I don't expect that.
Yeah. Peterson was also explaining whether the tumor is stuck or can peel away from the dura. Like, it makes a big difference.
It'll be the first time one of these couldn't peel off the dura. We can peel it off the dura almost all the time.
Okay. Because she made it sound like if they can't peel it off and it leaks the spinal fluid, they're not going to do the plaque, I guess.
Yeah, well, that's a different thing. If we get a spinal fluid tear, they're not going to want to put the plaque.
Yeah.
But we can close that up.
Okay.
So most of the time, these things come right off of the dura without a problem.
Okay. All right. Okay.
So.
All right. Well, it'll be interesting to see that 3D model. So I was
Yeah.
kind of hoping to see that today.
I wish so too, and I don't know why they waited to the last day. I know that it takes them a day to make them, and there's a backlog.
Yeah.
And they kind of schedule kind of around when people were going for surgery, and they had the model. They put it in yesterday morning or something, and it takes a good 18 hours to do it. They have to pick the different plastic colors and all that stuff.
Mm-hmm. Okay.
So,
All right.
so, but I talked to Rose this morning. He said it's sitting out at his desk at St. Mary's.
Interesting.
So
Okay.
okay.
All right.
Okay.
All right. Well, I don't have any other questions. Do you? Okay. So
Okay. And I'll be in to see you.
time to give the hospital some money. Morning of the 30th. I got 3 or 4 hours of sleep. Use special soap. Clean my body. It's supposed to be special, kill everything, bacteria. Cortisone soap. last night. Use this morning. This is the only time you're going to see these. Just like Justin Timberlake, bringing sexy back. Very nervous, honey?
No.
I'm not nervous either. I'm ready to just get this over with.
Me too.
Let's do this. Well, I'm about as ready as I'm gonna be for surgery, so.
Mm-hmm.
Are you nervous?
You're steriled right up.
I'm sterile. Even my butt. Amanda wiped my butt now.
I did.
Lord. So anyway, see you on the flip side.
Love you.
No more.
No, you don't.
Alright, well, it's the 30th. I got about 5-10 minutes before I go into surgery, and I love you all. Family, friends, thank you for everything you've done for me. And it's going to be a 5-minute nap for me. I'm sure it's going to be, 10, 12 hours of waiting for family here, but everything will be fine. And I have full faith in God, and He's right next to my side. And I'll be a new, better man and stronger man because of this. I did that. So. Amen.
Amen. It's so funny. Long day. Oh, nice. You'll like that.
It's out. We got it all out. It went very well.
Good.
Slowly waking up now.
Okay.
We got good margins on most of it. We did have to get into it a little bit, which we knew.
Right.
But I think we got a real good resection. They put the intraoperative radiation plat down for 10 minutes, and so they gave that dose to kind of where we thought there might be a problem or something like that. And then we reconstructed, and we did a great. We had a lot to work with on the left side because that was the side less involved by this thing. A little less to work with on the right.
Okay.
I mean that we used the bone like building blocks.
Okay.
In order to attach to, because since the tumor was mainly on the right, the bone that we used over there wasn't as good as the stuff on the left. But we did get something done on both sides.
Okay.
And that looked pretty good. We put down some bone graft from our bone bank, and trying to think, one of the nerve roots on the right side, the right C6 was pretty banged up from the tumor. Yeah.
Okay.
Yeah.
Okay.
So what that could mean is he could have a little weakness with wrist flexion.
Okay.
Okay, or stuff in his right hand, which he probably had I think he had a little bit of that before.
A little bit, yeah. That from that
so
pushing on the
he
right.
He may see some of that, but it went very well. I'm expecting, he's gonna take a couple of days to bounce back from this. Okay.
Right.
They got the tube out.
Okay.
He's going to recovery. We're gonna have him in a collar for the next couple of days. Okay. He's moving his arms and legs. but he's still waking up.
Yeah.
They're going to check him periodically, and they're going to let me know later when they get a better chance to examine him, because he's not really interactive yet. He's just waking up from
Right.
anesthetic.
Right.
So,
Okay.
okay.
Okay. And what do you expect? How long he would stay in the hospital?
I'll have a better answer for you tomorrow.
Perfect. Okay. That
Okay.
sounds good.
Yeah, I don't know tonight. Okay.
Okay.
Based on just right now, I mean, typical would be
Yeah.
2 or 3 days, but I can tell you more definitely in the morning.
Okay.
So you hear all the cancer's gone?
Everything we could see.
Okay.
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 There's stuff we can't see. That's why it's getting proton beam.
Okay.
Okay. If we can't, with this kind of a surgery, if we can't see it, we can't take it out.
Right.
So everything we can see, we got.
Okay.
So
And the plastic surgeon, now he had given me a call
yeah.
saying he didn't have to do
He
as
didn't do
much
the
as what
rotational
he.
flaps. To be honest with you, that's a good thing.
Yeah. Okay.
That's a good thing, because that means when they start moving muscles around, they start changing the way the muscles are going to work.
Okay. So
So,
what exactly did he do?
We just closed it primarily, which means we just opened it
Okay.
and then we pulled it closed like a pair of drapes.
Okay.
Okay, and then sewed it back together. So that's all that we need to do.
Good. That's good news.
Okay.
Okay.
All right.
Perfect. Well, thank
I'll
you
be in
so
tomorrow
much.
bright and early to see everybody.
Okay. Sounds good.
Okay.
Thank you.
Okay.
Lord, we come together in your name as a family and give you praise and glory for bringing us together, and we can see that Todd is on the mend, a good report, and I just pray, Lord, that you will help him through the night. His pain will subside and go away, and he can rest easy, and that he'll be feeling good in the morning. Thank you, Lord, for the good report and all that the staff did to get here. And we just praise your name in Jesus' name. Amen.
Amen.
Tiny swallow.
How you feeling, honey?
I feel like I've been ran over by a Mack truck.
Yeah.
But I tough son SOB.
You are. You made it. You did it.
Yeah,
It's done.
I got full strength in my right arm.
Yep.
I can squeeze it so good. I just got out of surgery, so y'all can f yourself.
Honey.
Okay, I'll do what I can.
Oh, you. Okay. Now we just get rest.
Sorry for my language. What happened if I had a private room? Just kidding.
Oh my gosh.
Oh my gosh.
Yeah.
My neck hurts so bad.
Yeah. I love you.
I'll hit you.
Okay.
Well, the second day past my surgery, and yesterday, I suppose it would have been this morning, was the worst by far. I've never been in so much pain in my life. I can't move my right arm at all right now. I can't even lift it. And that's the most I can move my right arm. But I have full mobility in my left arm, but my fingers feel like pins and needles. But when they were trying to set me up, 90-degree sitting position, it was the worst pain I've ever experienced in my life. And they were pumping me up with so many pain pills and painkillers and drips and you name it.
nothing was working. I'm fighting along. Like I said, I'm gonna walk out of this place better than I walked in. And I got a feeling this mobility will come back.
But
Love you all.
this is started from like Eau Claire.
Sure.
I'm ready.
Sure. So
I need some help here, and people will listen to me. And no one listens to me.
I hear you.
And they're like, "We're putting you up on your feet. You're walking today." I'm like, "I am not walking today."
Well, today, right now, the priority is kind of shifted, I think, now towards pain control. So the things that we've done now is we've bumped up that PCA, that push button on that hydromorphone, the Dilaudid, to 0.6 milligrams every time you push it, as opposed to 0.4 milligrams. We gave you that dose of the ketamine through the IV, but it was a 20 milligram dose, kind of a what we call a loading dose, as opposed to the infusion, which is a lower dose over a kind of a longer period of time. That medication is really helpful in conjunction with this IV opioid that you're getting, that Dilaudid, because it helps treat the pain in a different way than the opioid does, so they work together. You're going to go downstairs to the PCU, not because anything has changed medically or we're concerned about anything new or anything like that. When people are on higher doses of IV pain medications like you're on, or like we're going to be putting you on, then we like to just monitor people more closely. So again, this floor change doesn't represent any new concern that we have or anything like that. It's just a matter to be able to keep a closer eye on you as we sort of titrate or change the doses of the pain medicine
I
that
told
you're
from
on.
the start, that gabapentin's not going to do anything.
Yeah.
So why didn't they put him on morphine right off the get-go?
You know, I don't know. We kind of came as soon as we got the consult this morning, and morphine is just, it's not as good of a medication as the Dilaudid that he's
Well, I
on
don't
right
know
now.
the difference. I just call it morphine.
No, that's
I didn't
okay.
even know what Dilaudid is.
And we don't expect you to. There's lots and lots of different pain medications, but this Dilaudid is about 4 to 5 times more potent than morphine with less side effects. If they would have put you on morphine, I think your pain would be worse. You'd probably also have other side effects like nausea, stomach ache, things like that. People a lot of times just don't tolerate morphine. Oftentimes, too, there's more itching with morphine compared to Dilaudid. So that's why we're on that one. And that's why we kind of bumped up on the dose of that Dilaudid compared to what you were on, even when we came in, a couple hours ago.
Okay.
So
it's just a different level of similar to morphine.
Exactly. Similar class of medication called opioid pain medication, but it's just more potent. It's stronger.
Okay. All right.
Less side effects.
You know,
You know what I think is happening? Is my nerves are inflamed, and they're pinching the cavities that they're in,
Mm-hmm.
and they need to be brought down first before you ever even think about tipping me up on my ass. Tell me I'm wrong.
I think that certainly after surgery, nerves are irritated, and everyone responds a little bit differently in terms of how irritated they are after surgery. But again, I think at this point, you're more comfortable in this laying down position. From a pain standpoint, I say we keep you in that position until we can just continue to get you more comfortable.
But you don't stick someone like me in a shared room with someone that literally got up every 15 minutes to take a piss, and my neck is in the most outrageous pain, and I'm telling him don't give me, my neck is in pain. My neck is in pain.
Yeah.
And no one's listening to me. And they're like, well, we need to sit you up, you gotta eat. Well, I get that, but you're gonna kill me doing it. And, same thing happened. I mean, I was...
That's super frustrating. I'm really sorry.
I'm sick of repeating myself.
Yeah.
So did they have him on this thing that's similar to morphine? Did they have him on it as like at 3 a.m?
No, they just gave me 3 gabapentin.
Why didn't they have him on that at 3 a.m?
I don't know. All I know is what we saw when we came in, sort of what we started. So you'll have to ask that service, because I don't know what decisions were made.
All I got was 3 gabapentin.
But I think the plan here now again is to really just focus on pain management with IV medication through this hydromorphone or the dilaudid PCA, the button you're going to push, and the low-dose ketamine infusion that we're going to do.
Todd, are you
And we'll come and
hungry
check on you
right
later,
now?
okay?
Okay.
Would you like some broth?
Really nice to meet all of you
Yes, boy.
guys. I think he's going to be looking better this afternoon, is my anticipation.
Protein shake.
All right?
Okay.
And I'm gonna give him.
Really nice to meet
Thank
you.
you. Nice to meet you too.
I just need
Todd, so good to meet you. I'm going to check on you later, okay?
I
After you're downstairs.
apologize. I'm not yelling at you, but
No, nobody.
I just literally went through something like where I felt like I died.
There's no reason
That was
for you to
just the
apologize.
drugs, honey.
No reason for you to
Just the
apologize.
drugs.
You're doing fine. Nobody's offended. You're
You
you're
don't have to
perfectly fine. Yeah,
apologize.
don't need to apologize. Okay.
For that pain down my right,
Oh,
my left arm was insane.
Couldn't imagine it. I'll come check on you later, though. Okay.
Like that nerve, whatever that nerve is on my left side was being pinched,
Yeah.
being so high.
All that pressure from sitting up was pushing.
Oh
that.
my god, it was insane. It was insane.
Yeah.
Like I couldn't control my body.
Yeah,
I couldn't control it.
I don't blame you.
Like my teeth. I was grinding my teeth and like trying not to bite my tongue.
Okay.
And it was like convulsions almost.
Yeah.
Well, we got you in this new position. I think that'll give you some relief.
What? Yeah.
Okay.
Can I steal you?
Yeah. We'll see you, Todd. Okay.
All right.
Thank
You're
you.
very welcome. We'll see you guys.
Can I bring you over your toes?
You have to lift me up.
Use your legs. We'll count to 3. Okay. 1, 2, 3.
Hold still for just a second. We'll get your backside covered. Ready?
Okay.
This way. We're down that hallway, Kim.
Yep.
My other holiday decor.
You're walking so fast, I can't keep up.
Yeah.
This is
like an idiot.
this is Superman. What did he say?
He feels like an idiot or something.
I know.
I wouldn't call it an idiot. I'd call it Superman. This is pretty awesome. He's walking.
Alright, that's good. Finally took my first steps sitting down, and they literally have me on horse tranquilizers. There's nothing else that would work. This pain, if I didn't have these drugs in me, there's no way I'd be doing this right now.
And he's got a popsicle.
I can't move my right arm at all. A little bit, but that's about it. I took my first steps. Okay.
I don't think they do all those shots
Getting these involuntary like lightning bolts going down my left arm to my pinky, and I was like convulsing. Kim, can you explain it better maybe? I don't.
He had so much pain that he was grinding his teeth.
Okay.
And
So then this pain unit came and they gave me every painkiller underneath the spectrum, and one of them,
he was.
I mean, I thought I died. I was like having a dream almost.
Really, it was a med
like,
that was.
I came out of my body and I was looking at my body. I'm like,
Ketamine.
and I'm asking everyone, I'm like, am I dead?
Ketamine. So did it help with the pain?
That made it way worse.
Okay.
I mean, my whole, I couldn't move my whole body then.
They'll be by today, and we'll, we can rediscuss with them what to give you, okay?
The thing that made it better was as
So
soon as,
I'm like,
as
don't
soon as
give
we
me
laid
more
him down.
painkillers, lay me flat again.
As soon as we laid him flat,
Well, that's normal right now because of what's been done, and so.
But I mean, I have full strength in this arm, but except for the pins and needles. But like,
the right arm is just really hurting to do stuff.
I can't lift it.
Can you feel me touching you?
Yeah.
Okay. I'm gonna do something with that arm. Can you straighten it out? At the elbow. Like this, straighten it out. Okay, yeah, now pull it back in.
Like I have like all strength in it. Like I can tug, I can squeeze your fingers.
Yeah.
I just can't lift it up.
I think some of it's pain related, And
Like,
we are giving
let
you
me
this-
squeeze your fingers right now.
Yeah, I know your grip strength. Ross told me your grip strength was fine.
But like, to do a chicken wing right now.
Yeah.
I can't do that.
How about just bringing it up and do a curl?
I can do that if you put it in that position.
Yeah, that's okay. I don't want you to have to get down to do that. I'm just going to support your elbow. Do a curl here. Okay, bend your wrist up. Okay, bend it down. Yeah, it's just that I know what's going on here, and there's inflammation of the fifth cervical nerve root.
Okay.
We're giving you steroids for it.
All right.
Okay. I'd send you down for an MRI, but I can tell you, we're not going to see anything we can do anything about because it's just going to be,
I think I just got to give it time.
I
But
think
you know what
that's,
helped me the most?
What?
Is I was able to walk twice this morning.
Well, that's why we want to get you up.
And I'd like to walk again.
Yeah, well, it looks like they're set up for you to do that.
Yeah.
And the only reason we're keeping you in the ICU is because of one of the medications you're on. As soon as we get you out of here, we'll be able to move you around upstairs and have you do more up there.
Yeah.
Okay?
But I was taking this. What's this painkiller that's on me right now? Or I pushed the button.
I don't know. It's
Dilaudid.
Dilaudid. So I would hit that and instantly dry my mouth, and
Yeah, that's what. That's,
it made me like nauseous. So
have you taken anything like narcotics before?
No.
That's what they do. They'll dry your mouth out. They'll make you nauseated. They make you sick to your stomach, and they make you constipated.
Yeah.
So that, and all of them do the same thing. Okay, so it's a kind of a balance between you getting your pain under control, which we want under control, and trying to avoid some of those side effects. The more you mobilize, I think the quicker things are going to get better.
My neck pain is still the same the whole time.
Yeah, it's going to be like that, I bet, for another day or so.
Okay.
Okay? You just got to give it time.
But the first night and yesterday was a nightmare.
Yeah, well, that's why we had pain service come and see you. So, and they'll be by later. So,
Okay.
all right. Okay?
All right. Well, it's,
Yep, I'll see you later.
what day is it?
Time, okay?
Friday,
Mm-hmm.
December 2nd. And I still have excruciating pain in my right neck. I can move my left hand and I got pretty much full strength and mobility, but I have pins and needles in my 2 fingers here, and if the pain medicine wears off, the pain instantly shoots down my left arm that had no pain before. My right arm, I can't really move at all. There's no strength in it whatsoever. And I can move my hand. You see my right hand? I can move my right hand. And I can squeeze and move my fingers. But I can't do a bicep curl or pick up my arm at all. And that's where I'm at right now. So we're going to do some rehabilitation exercises to see if I can get some mobility back in my right arm. But the day after my surgery was terrible. They gave me the wrong pain meds. I threw up. And I was by myself all night. And staring at the ceiling in pure pain. Because they gave me the wrong pain meds. And it wasn't until, I don't know, 3 that they changed over my pain meds to something that kind of worked. And then yesterday they took me to an ICU and monitored me under some type of horse tranquilizer pill drip that I forgot the name was, but it's used on horses. And I got rid of the pain, but they had to monitor my heart because it's so powerful. And that's where I'm at right now. And I'm hoping this mobility comes back in my right arm, which I'm sure it will, but I just got to do these rehabilitation exercises because, like, I can feel it. It's not numb, but I cannot pick up my arm right now. And I got a rehabilitation expert coming in on a daily basis to help me with my right arm. And I'm hoping to get this collar off, which has 2 drain tubes draining any pus and blood from my incision, my neck. And they're unable. They didn't have to move a muscle for my back. They just closed up the wound, which was good. But my neck is in the same pain as it was the day after the surgery. But I'm still kicking ass. And I have no clue when I'm getting out of here. But I'm still going to win. And I will prevail.
20 gigs for only $40 per line. And just for the holidays, get the Samsung Galaxy S7 Edge for only $15 per month. No trade-in required.
I love you in that. No, I love you in that. No, I love you in that.
Alright.
These offers end soon. Get the best deals and the best network.
Doing good without a walker.
Lose weight just in time
You
for
are.
the holidays.
Stay tuned for a
You've
limited
come a long way.
Yes.
I'm Marie, and
You
I
did
lost
it.
50 pounds on Nutrisystem.
Be one of the first 500 callers and save $80 right now.
I'm Melissa Joan Hart.
Oh.
And the neck brace just came off.
Just came off.
Lose up to 10 pounds in your first month and 5 inches.
Alright.
It's amazing.
Just gotta get the strength back in my right arm and we'll be good to go.
Yep.
Order your 20
Love you guys.
right now and we'll rush you to
Babe,
Hi.
brush my teeth. We've been there Wednesday, Thursday, Friday, today's Saturday.
Mm-hmm.
So just got to get the strength back in my right arm, and I'll be top notch. I think.
Yep.
Go home, right?
Right.
And then I'll look behind my neck. Maybe pull down my shirt. You see down there?
That goes way down. Yep.
It's about 15 inches long.
About a foot.
Other than that, I'm doing pretty good.
Mm-hmm.
Like I said, I'm gonna walk out of this place better than I walked in. And I think once I go home and I can recover for a few weeks, get some strength back in my right arm with some rehabilitation exercises,
Mm-hmm.
we're good to go.
Yeah.
Right?
Yep.
Beginning.
Tell you more.
One X-ray.
No more tumor.
No more tumor. You're just full of.
Bionic man.
Yeah.
And then 11 more proton treatments.
Yep. And Todd's favorite nurse.
Yeah, my
Yeah.
name badge.
Yep.
He says it's time to turn the party's leadership over to the next
Oh, I feel so much better.
So much better. And what are you eating?
Toppers, which I shouldn't be eating.
Sure, it'll make the conference
Yeah. It'll make you poop. You're doing good.
Oh man, I didn't even use a walker.
No.
From that bench to this bench.
Yep.
So doing much better over the last 3 days.
Yes.
Not like feeling like I was leaving my body and dying.
That's not happening.
So never give me those drugs again. Whatever that drug was, just don't ever do that.
Ketamine, right?
Yes.
Oh my god.
Well, that's
I was
done and
asking
over.
everybody, I'm like, did I die? Like straight up, I thought I died.
I know you did.
Like, I'm like looking at my soul left my body, and I was looking back at my body, and I thought I was dead. It was the weirdest thing.
Heavy duty stuff.
Mm-hmm.
And my whole body hurt after they gave that to me. And I'm like, straight up thought I was dead.
But you're on the mends now.
Damn straight I am.
Yep.
I'll be back.
All right.
Enjoy your toppers.
Alright. Alright, so this is Farron. She's probably one of the, not one, she is the most amazing nurse here at Mayo. And she's gone out of her way to actually listen to me, which is a fresh change of pace compared to a lot of the other nurses around here. I'm not downplaying the rest of the nurses, but she is by far the best I've ever had here. So I love you.
You're doing great. You're gonna keep doing good.
So,
Tough love. It gets us
Yeah.
a long way.
am I cocky?
No. That laugh is mischievous, though,
Yeah.
let me tell you.
So, I think I'm doing pretty good, aren't I?
Yeah.
Yeah, so,
I would say not quite a 360, but you're pretty close to that
yeah, so,
from the first day we met.
she's an amazing nurse, so if you have to request a nurse, I would ask for her.
Thanks.
So, thank you for all your help.
You got it.
Thank you.
My pleasure.
Yeah,
It's been an honor.
thank you. How long is it?
Say about a foot long.
Alright, sounds good. Not much movement here, but that's about it.
Hello.
Hi.
All right, we're going to do dismissal teaching.
Okay.
First, let's go over the drains.
Okay.
Okay. So basically, we like to drain as much fluid as we can as possible.
Okay.
That promotes healing.
Okay.
So the plastic surgery, their requirement is less than 30 cc's for 2 days in a row.
Okay.
So for a 24-hour period, less than 30 cc's or 30 milliliters.
Okay.
So if you get that one day, then you need one more day of that in
Yeah.
order to pull them out and get them pulled out.
And there's a vial that says that comes with this pack.
Yep. So they'll Courtney will give you something where you can measure.
Yeah.
And what you do is you'll keep a journal, and at least twice a day,
Yeah.
maybe 3 times,
Okay.
you'll open it up, and there are instructions in here in terms of, and Courtney will show you too. She'll go through everything with you.
Okay.
In terms of taking it off section, you kind of pull the tubing, dump it, measure it, record it.
Okay.
Put it back on section.
Yeah.
And wait till your next.
I think what we'll do is we do it 3 times a day, 1 in the morning, midday, 1 at night.
Yep. And what you do is just keep a little journal, write
Yep.
down the volumes, add them up at the end of the day.
Okay.
And then once it gets to 30 millimeters for 2 days, 30 cc's for 2 days,
Yeah.
if that's before you're scheduled to come back and see us.
Okay.
Right now, plastic surgery has you coming back at, we have you coming back at 2 weeks.
To remove the sutures.
To remove the sutures, see us,
Yeah.
look at your wound, get some x-rays.
Yeah.
If it's before that they're less than 30 cc's,
Yeah.
give us a call.
Okay.
And then the what we'll decide to do is move that appointment up or see if you can have them removed locally.
Okay.
Okay?
Yeah.
While the drains are in place. So here, you've been on IV antibiotics.
Okay.
We're going to send you home on a twice daily oral antibiotic.
Okay.
As long as those drains are in, you'll continue to take
Yeah.
that.
With
Okay?
the 2 different discs.
Correct.
Yeah.
Correct. Now, Courtney again will go over the emptying, measuring, and then the changing. The
Yeah.
changing of the dressings is every 3 days.
Yeah, what she's gonna do.
Yep, where they put the little bio patch,
Yeah.
you have the little disc,
Yeah.
and so it helps with
Do you have like an anesthetic to clean it off with?
So just alcohol pads,
Yeah.
just the perimeter,
Yeah.
just a simple alcohol pad. Put that bio patch, which is just a little disc that goes around the tube that's
Okay.
coming out, and then a dressing, a clear Band-Aid over
Yeah.
it, which we've included for you.
Okay.
Okay. Again, that's only every 3 days, so we've
Yeah.
included enough for 5 changes. So
Okay.
you'll have enough for that. Okay.
Okay.
So that's with respect to the drains. You can use safety pins to kind of keep them kind of as much as you can, not too obtrusive, and
Yeah.
just being careful when you're moving around that they don't catch on things.
Okay.
If one comes out, it's not the end of the world.
Yeah.
Okay. But we're just trying to keep them in.
Not get infected.
Right.
Yeah.
Right. So that's the drains. In terms of the therapy, I got your prescription. So in your summary, that the physical therapist says in terms of your balance and stability, you're doing well enough. You don't need probably aggressive therapy from that standpoint.
Yeah.
But in terms of the right arm, you
Yeah.
can continue to benefit
Yeah.
from therapy. And a lot of that will be more occupational therapy than actual physical therapy.
Okay.
But you have a prescription that will cover you for both.
Okay.
So you can kind of pursue that in Eau Claire
Yeah.
when you can get hooked up with them.
Okay.
In terms of your medications, so for
No, I have a ton of GABA.
correct.
Already.
So I would continue. I did not refill that.
Yeah.
I think you continue what you're taking, the 300 3 times a day.
Yeah.
Okay? Just stay
Well,
on
they're
that.
100 mg pills.
Right.
Yeah.
So I didn't change in your summary. I didn't write a new prescription. I just changed it to document that you are up to the recommended 300 3 times a day.
Okay.
So it's I didn't give you a new prescription for that.
Okay. So like take 9 pills a day then.
Right.
Yeah.
Because that's what you're doing now. That's what
well,
we're giving
before it was 1 pill 3 times a day.
Yeah.
So now you want me to take 3 pills once 3 times a day.
Because that's what you've been taking here.
Yes.
I believe.
Yeah.
Had you titrated up before you came here?
No, well, do you want to show her that bottle, honey? Well,
I've seen the
Yeah.
instructions.
Yeah.
So I know that usually we have you go up slowly,
Mhm.
but right now you seem to be tolerating the 300
Yeah.
what you're doing here.
Yeah.
So I think you stay on that.
Yeah.
Don't make any adjustments for that.
Okay.
Okay. For your other pain, so you have so we already talked about your antibiotic.
Yep.
Okay. So I gave you enough for 2 weeks because
Okay.
that's going to cover you until you come back and see
Yeah.
us. If at that time
Can you get
more,
this set up to be forwarded to the Target in Eau Claire so we can just pick it up?
So let's talk about that after I go through all of them.
Okay.
So we have the Valium, Okay, that's for the muscle relaxant.
Yeah.
So I have here 3 times a day. That's the 5 milligrams. Take
Yeah.
it 3 times a day.
Okay.
For your other pain, there's the Dilaudid, which is the hydromorphone.
Yeah.
That's the narcotic pain medicine. You've been taking it every 6 hours, and
Oh.
you've been taking 4 milligrams.
Okay.
I'm giving you 2 milligram tabs, so you can take
Okay.
1 to 2 tablets.
Okay.
Every 6 hours. If the pain gets really bad, I'm fine with you going to every 4 hours.
Okay.
You can just you've been tolerating it every 6 here.
Yeah.
So I think you can kind of see how you do. Now with this, in terms of weaning off of it, how it works is after a couple days, I take it pretty consistently. The first couple days you're home.
Okay.
And then once you're feeling pretty good, you can say, well, I'm due for my Dilaudid. I don't think I need the full 4 milligrams. Maybe I'll just take it 2 milligrams.
Yeah.
Or if you notice, I really don't feel like I need anything yet.
Yeah, we're just
try to do every 8 hours.
Gauge it.
Exactly.
Yeah.
So there are 2 ways to wean the narcotics. You can
Yeah.
take less of the dose, or you can take a longer interval between doses.
Yeah.
If that makes sense.
Yep.
So some strategy works better
Yeah.
for particular patients. So just see what works for you. Okay.
Yeah.
I gave you plenty, given what you're taking now.
Yeah.
Plenty to last you for probably at least 2 weeks.
Okay.
Okay. The steroids. Dr. Krause had you on steroids just to help with that spinal cord swelling.
Yeah.
Okay. So you've been taking 4 milligrams 4 times a day here.
Yeah.
What we're going to now transition you to is twice a day.
Okay.
So you'll take 4 milligrams twice a day,
Okay.
and then we're going to slowly march down.
Okay.
So over the course of 10 days or so,
And
I
that's
have
in the
instructions here.
instructions.
Yep.
Okay.
So you'll take, the annoying thing is that they're 1 milligram tablets.
Okay.
So you'll take 4 tabs twice a day. So today you'll take, after you leave here, you'll take 4 milligrams
Yeah.
this evening. And then tomorrow you'll do that 1 more day.
Yeah. That should be on the prescription bottle.
Exactly. And then you'll go to 3 twice a day for 2
Yeah.
days, 2 twice a day for 2
Yeah.
days, 1 twice a day for 2 days, and then 1 once
She's
daily.
gonna be helping me.
Yep. And this is all written down. It's very logical in
Yeah.
terms of how it goes down.
Mm-hmm.
While you're on the steroids, it kind of increases your risk of indigestion, heartburn, ulcers. So we have you on the omeprazole, which
Okay.
is the helps with the reflux.
Yeah.
So continue
So I don't
that.
burn a hole in my
Yep.
stomach.
Continue that as long as you're on the steroids.
Okay.
Okay. And then lastly, stool softeners. So the Miralax, you've been taking that here. You don't have to take it. But if you
We've been
feel-
doing it over the counter.
Yeah, and
Yeah.
that's fine. You don't have to. A lot of times, I just print out the script. It's more of a reminder for you.
Yeah.
And then this is also, you can buy this over the counter too. The Senna Docusate you've been taking.
Yeah.
I would take that as long as you're on the Senna Docusate. I would take as long as you're on the Dilaudid.
Okay.
Just as
Because of the Dilaudid is what's burned the hole in the stomach. Yeah.
well, this was more for constipation.
Oh, yeah,
The
yeah, yeah.
omeprazole is for the dexamethasone, which is the
Oh,
steroid
yeah, yeah.
with the stomach.
Yeah.
Does that make sense?
Yeah.
Now, in terms of, I understand in terms of Target and Eau Claire, that's your pharmacy.
Yep.
My question for you is that, so I can electronically send some of these, but some
It's
of
a pain
them.
in the ass for you.
No, not a pain in the ass at all. The narcotic pain medication and the Valium,
Yep.
they have to be paper scripts.
Okay.
So I can give these to you, and you can take them to Target, the Valium, but then you'd have to wait.
Okay.
Whereas I know it's not
Regardless,
too,
I'm gonna have to wait anyways, right?
Right,
So
but
why
it's-
don't you just give them all to me and I'll just hand it to them?
it's because I can. That's the only.
I'm gonna have
thing-
to wait anyways, right?
Right.
Okay,
Yeah.
so let's just do that.
So I can send some. That's the thing.
worry about
I can send some of them, but not
Yeah.
all. Of them.
Perfect.
Yeah.
That's okay.
If I gotta wait for one, I'll just wait for one.
Okay. And then we should be able to give you some doses right before you leave,
Okay.
so you won't be because Eau Claire is what hour?
Couple hours.
2 hours.
Yeah.
Okay. So we'll give you doses. We'll plan to give you a dose before you leave.
Yeah.
So then you'll be covered. Take them to the pharmacy
Sounds
and can
good.
get the next doses there.
Yep.
In terms of the summary, we just have kind of it goes over what happened here. Mainly, in your case, the main complication we talk about is the severe pain after surgery.
Yeah.
We'll try and go into the ICU, having the pain specialists involved,
Yeah.
and then we got the physical therapist to come work with you, and just how you made progress in terms of your
Yeah,
pain
last
and
2
mobility.
days has been night and day difference.
Yeah.
It's like,
Yep.
Not
So
even.
that's just this text just kind of tells the narrative
Yeah.
of kind of basically what happened.
The first 2 days was the worst by far. So.
No, you look like night and day from when I last saw you.
Yeah.
You know. So then this next section is the medications that we just went over.
Okay.
Again, in terms of medications that were discontinued, you don't take any ibuprofen, Aleve,
Yeah.
naproxen, as long as
Whatever
you have
you're
that fusion.
subscribing is what I'm dealing with.
Correct.
Oh.
We don't want you to take any of that Motrin or anything because that
Yeah.
interferes with the fusion.
Yeah.
Okay.
Especially like thinning the blood.
That as well.
Yeah.
Our more of our concern is the interference with bone healing.
Yeah.
Okay. And that's for at least 3 months. We don't want you
Yep.
taking any of those. The Bactroban you finished, so you don't have to take that.
Okay.
And then the oxycodone, we're going to prescribe you with Dilaudid, just like you
Yep.
said. You're going to use that, not the oxycodone.
Yeah. I do have a bottle of oxycodone at home. I'm throwing it away.
That's probably smart. That's what I'd recommend too. So when you come back in 2 weeks to see plastics, you'll also
Yep.
see Dr. Kraus with some x-rays.
Okay.
Okay? He wants to keep a real close eye on that upper part of the construct.
Sure.
Okay?
So I think he was kicking around the idea of possibly doing the front too.
Going from the front.
If they need it.
Exactly.
So.
That's why he wants to keep such a close eye on it, because if things are showing that they're going to change,
Yeah.
he's going to have a low threshold to recommend that
Yeah.
for you. And
I think that kind of explains the huge screws at the bottom, right?
Yeah.
Because
Yeah.
it's kind of like based at the bottom of my back.
Right. And because the screws at the bottom of the construct, they're just stronger than the screws
How
at the
long are
top.
those little things? Those things got to be at least an inch and a half long.
Yep. About usually it's 25 to 30 millimeters.
Yeah. Okay.
Yep. It's different for everyone, but you're exactly right. Those ones are much longer than the ones on top.
Yeah, they're massive.
So in 3 months we'll have an MRI, but you'll see us before then. We'll
Yeah.
kind of talk to you about things.
Will that
before.
be here or Eau Claire?
It could probably be Eau Claire.
Yeah.
It depends on how things are going.
Okay.
Okay. We already
regardless, 2 weeks I got to come back.
Correct.
With X-ray. So,
Correct.
Yeah.
So the Dr. Carlson, the plastics team, they already put in the message. December 15th is when you have their appointment. Diane, Dr. Krause's nurse, put in for Dr. Krause's appointments today. Usually the offices are pretty good about coordinating.
Yeah.
So they're in the same date, so you don't have to run back and forth.
Okay.
I think we already went over the drain instructions. We already went over therapy. The incision. So you have stitches that obviously are going to be removed. We're going to look at them in 2 weeks, possibly take them out.
So it's like a little over a foot long.
Mm-hmm.
Okay.
If you notice any drainage, any redness, fevers, incisions coming apart,
Yeah.
you need to give us a call right away.
Yeah, I think we've been talking about is when we go to Target to pick up my pharmaceuticals, we're going to buy two full packs of white T-shirts.
Oh, okay.
And that way we could tell if we could see any drainage coming off this
incision
sutures.
Yep, that's great. So. That's a good idea.
Plus to keep it clean.
Yep, I like that. That's a great idea.
So.
The drain care we talked about. And there's a whole list. The plastics team was great. They put a very specific list in terms of what.
What I was happy was they didn't have to really move a muscle.
Right.
So that
they
was
just
huge.
did some mobilizing. Exactly.
Yeah.
Exactly.
So I think that's what's helping out so much right now.
In terms of showering, so in your summary it says you may shower after leaving the hospital. I'd rather you do a sponge bath.
Okay.
I don't really want.
What if I just don't do anything, and then I wait? What do you want? Wait a day or two?
Well, in terms of if there's a way to shower without, well, I guess you have the Tegaderms over the dressings, over the drains.
I don't mind waiting a day or two and then take a shower.
No, and I'm just trying to think in terms of the drains. I think it'd be fine to shower. I wouldn't leave your back with the shower head pounding on it. If that makes sense.
Just lightly go over it.
Yep.
Just for like 2-4 seconds.
Yep.
Good.
I wouldn't kind of soak it.
So,
and definitely no bathtubs or anything.
Yeah. Right. I plan on going back and watching this video to help remind me. So.
But I think you can. I think it'd be fine to shower because those dressings are pretty good at sealing the drain off.
Yeah.
Just like we said, I wouldn't
the
have
adhesive's pretty good on it.
Yeah. I wouldn't have the shower just pounded.
The key is just the holes for the drain tubes.
Right.
Yeah.
Right. Weight bearing. Okay, nothing greater than 10 pounds. Nothing more than a gallon of milk.
Yeah.
Okay. It says 4 to 6 weeks here. I'd do that at least 12. We're going to see you before then, but we're probably going to tell you to
12 weeks of 10 or less.
Yeah.
Okay.
Yeah. Right here it says 4 to 6. That's kind of. I'd be more conservative and say a full 12.
Okay.
Okay. I'm just going to cross this out and put 12 on here.
Good. You've been a great help, by the way.
Oh no, it's my pleasure.
So.
We already talked about narcotics and constipation.
Yep.
We talked about the non-steroidal anti-inflammatories, how we don't want you to take those because of the fusion. We talked about your medicines, the drains, the incision. I think that's it.
All right.
Courtney will probably go through a lot of this one more time. with
Okay.
you, okay? And then she'll show you how to do the drain stuff, so
Yep.
kind of you know what is going on.
Yeah, because she's gonna be doing it all. So.
And then again, if there are any concerns with the incision, just give us a call. We have an easy kind of mechanism that you can take a picture and send it to us, and we can look
Yeah.
at it and go from there.
Yeah, what we plan on doing is, my passion is doing these videos for YouTube, and I play a little bit of online gaming, so I think we got a really nice lazy boy at home.
Okay.
We're gonna cover it with a nice clean sheet.
Perfect.
Get a clean blanket over me, and then support both hands, and then I think just a little bit of movement with the mouse in my right hand will help increase that strength a little bit.
And I think as long as I think you need to keep doing multiple walks.
Right.
We were gonna do every day.
And when you and a couple walks per day. I think the goal should be 4 to 6 short walks per day.
Okay.
Again, that prevents complications like clots,
Yeah.
pneumonias, things like that. You're young, so you're less likely to get those, but still.
I think what we'll do is, I've been doing it already here every day, but I think we'll do 2 a day, and maybe would you recommend maybe doing a 2 or 4 block square?
Why don't you start with 2 block?
2 block square?
Start small,
Okay.
see how you react to it, and then
Okay.
build up from there gradually.
Okay.
And then even little walks around the house count in terms of getting the blood flow.
Yeah.
That's the main reason we encourage you to walk.
Sure.
But and then if there are any questions or concerns, we'd always rather you call us, okay? Either if you use the patient portal or you give us a call, someone gets back to you within 24 hours on the team.
Do you have a card that we can call?
I do have a card, but it's
Maybe
downstairs.
just write your name and phone number on there.
Yeah. Well, my phone number is the same way you get a hold of
Kraus.
Kraus. Yep.
Okay.
So that phone number is in here.
Okay.
And in the next coming weeks, it'll probably be someone else. Anyway.
All right. How's the belly feel?
It's good. It's nice and ready to go.
All right.
All right, I gotta get this page.
Okay.
Again, Courtney will be great. She'll go over things again with you, show you the dressings, and just don't be a stranger. If anything concerns you, just give us a call.
All right.
Okay.
Sounds good.
Safe
Thank
drive home,
you.
okay?
Yes.
I would stop at least once to get out and walk.
Okay.
Yeah, we're gonna do that in Duran.
Will do.
Okay.
Thank you.
But in order to start, you want to make sure that area that the drain is going into and your skin is going to be clean.
Yeah.
So I put extra alcohol wipes in here.
Yeah.
I just kind of
Just to sterilize it, sticks better.
Yeah, just to clean up because you're going to sweat and that's going to make the Tegaderm come off quicker and you don't want that to happen because then that's going to open up that area.
Yeah.
Now they've already got the gauze around it just to kind of soak up any drainage that's coming off of it. It should be done.
Okay.
It shouldn't be having a lot of drainage coming off of that now. It should be going into the drain.
Yeah.
So they want to make sure that when you have the drain half full, that you empty it so that you can monitor closely the output that the drain has. And that's for both the JP and the Hemovac.
You have 2 vials.
Yes.
Oh.
So you want to watch if you have a measuring cup to be able to tell how much output, or else I can grab you one of our drain cups too that you can take with you so you can just see exactly how much you've got.
Yeah, I just grab one.
Deal. So empty the drain bulb when it becomes half full, and that can happen up to twice a day. It should be slowing down. You shouldn't have a lot more drainage.
We're gonna do it 3 times. We're gonna do it 1 in the morning, mid, and at night.
Okay.
So
you might just empty out a very small amount, but that's still okay. Just watching to make sure that if you have too much drainage or quite a bit more than what's usually coming out on the drain, that you're probably overdoing it. Or
do you want to do it 2 or 3 times a day?
You can do it just twice is fine.
Okay.
Otherwise, 3 times you're hardly going to get anything out of it.
All right, we'll just do it twice.
So you also keep both drains compressed at all times, except when you're emptying. The compression creates a gentle suction. Record the amount of fluid you empty each time, total the amount of fluid, and make sure that within a 24-hour period, your drainage amount is recorded in a book. You might want to get like a little notebook or something. And then just keep track of it and the date.
Okay.
Okay. If the tube does not appear to be draining, contact your doctor. Refer to your education booklet provided in the hospital as needed, which is this. It's not really another booklet. Strip the drains 3 times a day. So when you strip the drain, have you done that before?
Yes.
Okay.
Yeah.
So we'll just take a look at it if it's okay. If you want to roll over onto your left side. I'm going to slide you back towards me a little bit, okay? You okay?
Yep.
All right. So when you're stripping the drains, you just want to make sure that you are going from the top and holding on to the tubing so that it doesn't pull at the skin. That's going to irritate your skin, and it's going to possibly pull the drain out. We don't want to do that. We want it to stay
you
right
recording this on?
where it's at. So I'm going to pull this tape back here. Right now we have only the gauze over the top of it. So we're going to do an alcohol wipe, and I'll show you the steps that you follow.
You can clearly see it on the video.
So the steps are right here. This is to empty the drain, not to change or do site care. So to do site care, you kind of have to look through, and there's a couple of places in there where it just says to make sure to keep the incision and the drain site area clean. I've highlighted and included another one that kind of gives you a step-by-step.
Okay.
And it's a little bit clearer.
Okay.
You tell me if I'm hurting, okay?
No. Now you're cleaning it, right?
Yep, I'm just using an alcohol wipe, and I'm just going around the area where you've had that drainage. You want to clean up any of that.
But the gauze is still there, right?
Yes, the gauze is just laying kind of on the side of it. I'm cleaning up right around it. Now what we're going to do is we're going to remove the gauze altogether, and then we're just going to have the Tegaderm and the disc over the top. Now you can put the alcohol wipe even over the top of the tube and clean it up, because that's going to have some dried blood. The type of drainage that you really want to watch for is, if you kind of look at this gauze here, you can see around the outside there's some drainage that looks a little bit darker. It's kind of a brown color. You want to avoid seeing any more of that type of fluid.
Yeah, we figure we're just gonna wait till you get home and take a shower now.
Do a sponge bath.
Yeah.
Or if you do a shower, just make sure that you're
We're just gonna do a sponge bath.
not submerging.
Just one less step.
So a lot of times if you have the drains press up really close to your skin and you're laying on them, because of their position, they're kind of at the edge of where, you know, how your scapula presses into the bed, and then you kind of have that area around your back that can kind of get sore because you're putting more pressure on it. It's almost where you're at. So these should kind of help just pull them away from the skin a little bit so that they're not, because I've seen those, they're like blisters that show up from the drains. So we want to try and avoid that. So the Tegaderm that goes over it is going to be able to just seal everything in and make sure and keep any bacteria and stuff that can sneak in there. It's the same things that we use to cover your IV.
Just this look pretty easy, hon.
Mm-hmm.
We're gonna be like a nurse pro after this.
So you've got extra tegaderms in there, and in this one as well. And so you can kind of.
That foot long incision looks good though.
Mm-hmm.
Yeah.
Yep.
Incision looks very clean.
Mm-hmm.
You want to make sure and watch for any of the drainage, but also watch to see that these edges along the incision, have somebody look at it every single day. Make sure that the edges aren't separating at all. That can be a sign of there's swelling underneath or there's fluid buildup that's not getting pulled by the drains.
Do you physically feign that and go over that with something too? Or?
Yeah. You can let the shower water hit it, but just don't let it be so irritating or put too much pressure where it starts
just for
to
like
get
2-4
irritated.
seconds, right?
Yeah. Just
Okay.
a quick rinse, and that's encouraged.
Okay.
And Doc will say too, just make sure that you're not scratching or scrubbing or irritating the incision, but cleaning it is a very good thing. You want to make sure and get that blood off because bacteria will grow. And that's what you don't want to happen. So just, And this one, I'm going to take back with me because it's not exactly, some of the things that are different on here are when to change the dressing.
Okay.
So this is for a daily dressing change, but it just gives you kind of the overall steps.
Okay.
How to make sure that your hands are clean, make sure that you're cleaning the site, and that kind of thing.
Okay.
But because it doesn't have Doc's exact notes on it,
Right down here.
6 days later.
Yeah.
Going on. Well, I would look at you, but I can't. But I'm super comfortable right now, and all I want to do is just go home and be in my own environment. So I'm doing really good. I have absolutely zero pain right now, and I'm ready to get this back on the road. So we're past the halfway journey point, right?
Right.
Love you.
Love you.
Well, I'm on my way home. 6 days in the hospital. I swore to God that I'd walk out of that place better than I walked in. I'm not kidding you. Complete warrior mode. I went from 3 days of thinking I died. My body, soul, above my body, my family, thinking I was dead, to being back in this vehicle back to Eau Claire, past PT with flying colors. And I don't know when I'll get this next part done, part 10, but it should be pretty amazing when it is done. So I got a lot of people to thank. I got my amazing girlfriend Amanda, amazing family and friends, all you Facebook friends that I've never even met my entire life, but I feel like I've known you my entire life. And I don't know, I know I probably look a little silly in these glasses, but that's fine. I'm heading home, and amazingly I'm pretty comfortable right now. I got very little soreness. I think I just need to get home in my own environment and rest and relax, and let God continue this journey for me. And I think it's a testament to putting all your love, faith, and devoting yourself to the Holy Trinity. Peace out, and I love you. Okay, so we're passing the Mississippi River back into Wisconsin. So that means I'm past the halfway point. I'm into recovery of roughly 8 weeks, 6 to 8 weeks roughly. And then I need to just go back for 11 more proton treatments. And this man's done. Done screwing around. I'm done to get back to my life. Moving on to enjoying what I like to do. And loving this woman to my left. That I love with everything in my soul. I love you all. I'm excited just to get home. We are officially in Wisconsin. Amen. Thank you, Lord. You happy daddy's home? Gonna make your nest. That's what he does. It's his little nest. Daddy's legs. Alright, you're getting attention too, Allie. You're getting attention. Alright. Daddy is home and he's cleaned up. Fresh new man. I guess Amanda won her scrubbing my butt bat. I woke up at 2:45 this morning, and I was so drugged up last night. I don't think I could take any more drugs. I was supposed to take 3 gabapentin, but I didn't. I was so drugged up that I don't think I needed it. I mean, I just woke up at 2:45 a.m. and it felt like I was sleeping on 2 railroad tracks full of hardware on my back spine, in severe pain. And I was able to roll out of bed, go to the bathroom, roll back into bed. But there's no way I was going to get my pain pills. I had to call Amanda's son Ryan to wake her up, and I was snoring too bad. She went and got my gabapentin and some other stuff I was supposed to take when I went to bed. But I don't think I could have took any more drugs last night. I was so drugged up. Oh man, I just woke up in the most worst pain ever. But hopefully this kicks back in soon and I can go back to bed. But just giving y'all an update, and hopefully I'll pass out here soon. Wake up in the morning. Seriously feel like I'm sleeping on 2 railroad tracks. So tired. Well, it's 6:30 and I passed out. Those 3 gabapentin and what other pills she gave me. It did the trick, and I was out cold. I feel much better. I still can't get out of bed. It's just so I feel like I'm stuck in bed. Just to move hurts. I'm gonna wait for Amanda to help me get out of bed here before she takes off. Take Ryan to school, but I think I just need to get up and move and get in that lazy boy, get in a vertical position, because I feel like someone laid 2 small chunks of titanium railroad tracks that my vertebrae are laying on. And it's just
First day after surgery is bad, but it's always the second, third, fourth, and fifth is the worst. It gets worse as the days go on. Hopefully after a week or two, life will start to get back to normal. I'm gonna pass back out here. It's like I'm in real pain. Well, it's Wednesday. I think it's December 7th. And I know this might sound like a small deal to some, but for me, I just got up at 12:05 in the morning, got out of bed myself, walked to the bathroom, pulled down my pants, took a piss. I have to pee like a woman right now, because if I pee like a man, I get it all over the floor or the seat. It pisses off Amanda, but I was able to take my pants down, sit down on the toilet, pee, pull my pants back up, and get back in the bed all by myself, which I'm getting my strength and mobility back in my right arm. Thank God. Still can't really push up high, but I'm getting there. All through the grace of God. This is, hands down, the hardest thing I've ever been through in my entire life. And, you know, Amanda's not sleeping with me because when I sleep on my back, I snore like a banshee. But she's in Savannah's room sleeping. That's okay. She needs the rest and relaxation too. But slowly but surely, as every day that goes by, I feel better and better. And I think I'm going to pass back out now. But for me, that was a big milestone. And I love you all. And I'll talk to you later.
That first incision is good. Or where the tube was.
Shoulders are cramping up. Suck it up. You might have to get off to that angle so you can actually see what she's doing.
Yeah, I am.
That one has a stitch, right?
Yeah, I'm just taking them out right now. Stitches are out. Okay.
I think it just fell off the side. Are you cleaning with alcohol?
What's that?
Are you cleaning with alcohol right now?
Yeah. How you doing?
Good.
Good. You're doing good.
Well, what's nice is the cramps are gone on my left shoulder, but I still got cramps in my right shoulder.
Right. So.
That's it?
I got it. You just wipe it up a little bit more with alcohol here.
You can go over the incision too.
Yep. I just want to get this first.
There's no plastic tube left in there. All right, so I've done this 4 times in a row, and I've yet to be able to do this yet and bench press just my right arm. Let's see if I can do it one more. This will be my 4th time in a row.
You did it. You did it.
I did it. 4 times in a row.
4 times in a row.
I couldn't do it yesterday.
That's awesome.
It's awesome.
It's awesome.